Good morning, everyone. This is Dr. Kusuma from Suria Cosmetic Surgery. So, I want to take an opportunity today to discuss some eyelid incisions and general eyelid surgery. Hopefully, that will clarify a few basic things for you. I just saw some consults for eyelid surgery, which is part of an overall facial rejuvenation that I obviously do a lot of, as I've been sharing with you guys. So, if you look at the eye from the frontal view, okay, typically people should notice the eyeball and where the relationship is of the bottom of the eyelid to the eyeball. What is the space that exists between these two spots? That is called scleral show. Typically, when there's too much gap between the eyeball or the what we call the iris and the eyelid margin here, and there's too much white between them here, because all of this is white, right? All of this around is white. If there's too much white there, it looks bad. It looks really bad, where people look like they've been pulled down too much, or their eyeballs are too prominent and they get dry eye problems. Aesthetically, it looks terrible. So these are things that you yourself can examine at home. If you're looking straight into the camera or to the mirror without looking up or looking down, but with a neutral face, and you're looking straight at yourself and eyeballs are looking directly in front of you, you should notice how much space there is between the bottom of the circle in the eye called the iris and the lashes or the eyelid margin, and how much space there is here, right here. If there's too much space, it's aesthetically bad and functionally bad. If it's touching or just slightly above it, it's ideal, because that means that the shape of the lower lid is an ideal position. Okay. Another thing is, you want to look at the angle of these 2 points, the inner point and the outer point. Some people's is going downward, some people's is more straight, some people's goes up in a little bit of a almond shaped direction. So ideally, again, a shape that goes in an almond shape in a little bit of an angle is always considered more ideal in a sense, for certain populations. Again, this has to be ethnically oriented to different ethnicities, because everybody has their own aesthetic standard. But for general purposes, again, not to get into nuances of that, a typical angle that goes a little bit at a oblique angle towards the corner with a very nice almond shape is what's considered to be ideal. The third one is, usually, if again you look at yourself in the mirror or in a camera and you're looking straight ahead of you, you will see a fold above the lashes, this little fold above the lashes. Everybody generally has a fold like this just above the lashes, like if you're looking straight ahead. Okay. And you have to notice how much space there is between this fold and your eyebrow, or the ridge of the eye right here that you feel the bone, or the eyebrow hair. The more distance you have here, generally, the worse it looks, aesthetically speaking. So these are some basic things that you should look for when you're thinking about eyelid surgery. The lower lid, also, you have to determine if there's a little bit of a faint hint of a line, and see how far that is from the lower lid here. Is this very long or is this very short? And the longer it is, the worse it looks, aesthetically speaking. And you also look for these bulges, called fat pockets, is what most people, like eye bags, or what most people call. Typically, we describe them in 3 different compartments, but they're really all generally together. They're separated slightly with some partitions inside the eye, but generally people talk about 3 different quote unquote bags or compartments: the outer one, the central one, and the inner one. And when when these show up too much, as we age, and sometimes congenitally they just are there, unfortunately for some people, but as we age and they show up more, they look like bags just sitting there. And especially with this crease look very low, there's a lot of room for it to just bulge out, and that creates a look that makes people tired. And because this is so low, there's a lot of skin that starts to look indented or depressed, and that creates shadows, and some blood vessels show up because the skin is thin, and that overall makes an appearance that looks like people are tired, people are, have bags under their eyes, and they just don't like the way it looks at all. In addition, this crease that I talked about, if it starts to come down towards the corner of the eye and goes even further down, that makes people look like you're sad. You can imagine in the corner of the eye right here, which is the outer corner, this is the nose obviously. If this crease ends somewhere here, it's good, right? But if it starts to extend and you get this little span of skin that starts to hang on the corner, it again creates the look where the things are more slanted this way, and that makes people look angry, not angry so much, but really sad appearing, like a sad puppy dog eyes kind of thing. And so that is also not an aesthetic appearance that most people probably prefer. So when eyelid surgery is discussed, all of these should and can be considered. If you look at the side view again, I just drew it before we started. You can see, you have to see, is this area low, or is this very low, or is this high, and where the bags are in relation on a side view. So ideally, again, you want this to be very smooth transition. You don't want these partitions. You want it to be very, very nice and smooth. You don't want this to show up. You want to see a nice crease like this, and you don't want this to extend down like this. You actually want it to go a little bit more like this. So you want the angle of the eye always to be going in that angle, in that oblique perspective, to make it look very sharp. In addition, the eyebrow also ideally should start in the low point at the center and go outward in a little bit of a vertical direction like this, not so much straight, not so much going down like this, because all of these downward trajectories make people look sad overall. So when you do assessment, you look at a lot of other things as a doctor, obviously, right? The health of the eye, the movement of the eyeball, the redness, all of those things that you look at when you evaluate somebody. But for a general perspective, some of these things you can look at yourself, and kind of determine, are you a candidate to do something about it or not? And these are things that your surgeon, if you come see me, I would discuss with you. So one of the things that we do in surgery for the upper eyelid is the incision, right? This incision. This incision is made in the fold or close to the fold so that incision doesn't show. Many surgeons end the incision here because they don't want to go beyond that, because they think it's going to show up, or that's just the way they're trained and that's what they do. And I've seen many issues where this segment of skin that we talk about is not touched. And although this looks nice and has a nice crease, this gives it away that it's not, in my opinion anyway, with other people may disagree with, which is okay, that it's not complete and it's not good. So my goal would be to come here and actually extend a limb kind of like that across, so that all of this skin can be removed and all of this can be nice and smooth. If I can wipe all of this off, I would love to see, I can finish this incision come across like this and just extend a little bit of a limb outward like this, so that this entire area looks very smooth and clean and there's no skin hanging down. And this incision heals amazingly well. It doesn't show, and you can always do a little bit of minor laser resurfacing to make the incision look even less prominent. There's also a variation of this. Some people like a very kind of what they call a foxy eye, or a more sharp of an angle. In that case, you can actually make an incision that actually also goes beyond that crease and goes like this, a little bit higher, so that you're exaggerating that sharpness that goes outward. And that's what people want to see when they do makeup and stuff. You can see them put exaggerated looks like that. You can actually create that look surgically that is more or less permanent, and a lot of people love it. Again, some of it depends on the age of the person. Some of it depends on just how they feel about beauty, which you have to discuss with patients. You can show them some pictures before and after like that. But so incisions can vary. So many times incisions end here, many times incision can end here, many times incisions can go above the crease a little bit higher. So you exaggerate and remove all of this kind of skin so that the corners of the eye look as clean as possible. And that's where typically Botox is also injected, right? Because these are the spots where Botox is injected. So you try to make those crow's feet lines much smoother. In this case, with surgery, you can actually pull all the skin up, remove it, and then you can create a more permanent look like that. And that is an aesthetically good look. For the lower lid, on the other hand, you have three various components that have to be looked at. You have to look at the skin quality, the skin color. Sometimes it can look dark. You have to look at the bulge. The fat is what it is. And then you also have to look at the skin laxity. Loose, excess. So for the lower lid, patients have, can have issues with the skin color actually. The bulge, which is the fat pockets, and laxity, which is just loose skin. So when you do lower lid surgery, you want to correct all three of them. Darkness cannot be corrected directly with surgery, right? Darkness is just skin texture, skin pigmentation. And while if there's lots of indentations, you can create a shadow of a look, which improves with surgery. But if you truly want to improve the texture, the quality of the skin, for this component, you have to do some skin treatments, whether they're laser resurfacing, whether it is with a little bit of surgery to create or remove the indentations, whether it's with microneedling, chemical peels, various components that can help the skin color and texture directly. The surgery indirectly helps it. For the bulge, you can camouflage it with fillers sometimes, because if you have a bulge, you can put a little bit of filler underneath it or whatnot. But ideally, the best thing to do is to either reposition that fat, meaning remove some of it and reposition it elsewhere where you can gain advantage of adding a filler sort of thing, or just remove it. That's what you do for the bulge. And as far as the laxity is concerned, very, very, very conservatively, you can do a small amount of skin removal so that you get a little bit more tightness of that skin. Most patients will require all three to get an ideal outcome, right? Surgery for the bulge hopefully will be just one time for most people. Laxity, most of the time, maybe just one time for most people. However, for the skin quality and skin improvement, you may have to do it on an ongoing basis to maintain it. But please remember, the idea of the bulges is that once you remove it, you're not done with it, because volume restoration is very important, so that oftentimes after you remove the bulge, you still have to add volume to the lid so that the lid looks nice and smooth across, and not stop with just the bulge removal. Many times that can be done at the same time of surgery. Other times it can be done after surgery, after healing is completed. So there's a lot of variations, as you can see. That's why in my practice, I make sure people understand all of these various nuances, because everybody's problem can be different and the solution needs to be different. So a standard procedure, upper eyelid surgery or lower eyelid surgery, sometimes also called a blepharoplasty, can vary. The operation can be completely different from one person to another person, right? Many times you have to do revision also, meaning they've had it done 5, 6, 7 years ago. They have some more issues. We have to improve if they're interested. So we have to do that also. So an upper eyelid surgery, sometimes called an upper eyelid lift, technically called an upper eyelid blepharoplasty, a lower eyelid bag removal or lower eyelid skin removal, or both, is called a lower eyelid surgery or lower eyelid blepharoplasty. Is very different surgery for different people. And ethnicities also play a role in this as well, right? So it's a very nuanced operation. It's a very delicate operation. It's a very technically finesse-based operation, because the margin of error is very, very, very small. So something for you guys to keep in mind. The next thing I want to talk about is what are the various surgeons that do eyelid surgery. Okay, it's important for you guys to know. So when you think of eyelids or eyes in general, you think about ophthalmology, right? You think about something called oculoplastics. You think about facial plastics. You think about what we call plastic surgeons or cosmetic surgeons. So that's what most people think about when you think about eyelid surgery. Most of the time, ophthalmologists don't do eyelid surgery. Some do, but most just focus on the diseases of the eyeball itself. You know, vision, retina, cataracts, and glasses and things like that. For the most part, oculoplastic surgeons or ophthalmologists who do some additional training to do aesthetic work or functional work around the eyelids, and they do that kind of surgery. And many of them are very good and they do a great job. Facial plastic surgeons are surgeons who do a lot of face surgery, and they also do eyelid surgery. And plastic and cosmetic surgeons also do eyelid surgery. I fall in these two buckets personally. I did some component of facial plastic surgery because I come from an ENT background as well, in addition to plastic surgery, and I did my full board certification and fellowship in plastic surgery. So I occupy these two spots right here. So I'm very, very well trained in all things face, eyelids, nose, neck, jaws, jowls, and all kinds of facial surgery, hair transplantation, anything to do with the face and neck, I do a lot of. So just so you understand the various type of surgeons who offer this. And all of these principles would be known by most of the surgeons who work on eyelid surgery, but I encourage you to kind of understand, take a few minutes to get educated on these things, and hopefully you'll be able to be more informed so that when you go get a consult, you can discuss many of these nuances with your surgeon. I hope this is helpful to you guys. This is something that I just discussed with a patient I just saw. I thought I would share with all of you because these are very common things that a lot of people want to know about. So thank you and have a good day.